It was quite a scary time for everyone. And as an organisation, trying to remain stable and secure, so contacting all the funders, all our partners, understanding what we could do and what we couldn't, and then as we start to move towards an online offer, it was about understanding where the people that had been left behind that didn't have the right tech or data, and trying to ensure that we could support them to do that, which was a really complicated process, because as I'm sure everyone's aware, it's never just a simple, I haven't got a computer. It's, you know, my Wi-Fi sometimes works or it doesn't, or, you know, my tech works in a certain room or whatever. So it was really complicated getting that information, especially from individuals that might not necessarily have a deep level of understanding of IT. So where we've got to now, very briefly, we've been very successful at running online stuff. We set up a forum, which we immediately managed to get around 100 members on. That's our beneficiaries, and now are delivering 10 weekly online interactive workshops, which are all well attended. We've noticed a growing peer-led interest as well, and we were doing things like radio podcasts and social events like live mic nights and quizzes and stuff like that. So I don't know if my time's overrun. I've tried to go quickly. Is that okay?
That was great, Bob. Thank you. I think I'm going to come back to you on how the tech stuff happened.
Yeah, sure.
Really interesting when we spoke about it the other day. Josh, can I bring you back here?
Of course, yeah. So I'm Josh. I work for Improving Lives Knots. So we're a charity in Nottingham City which supports people with complex health and social needs. So we kind of support people with long-term mental ill health alongside kind of social problems which exacerbate that mental ill health, kind of like housing issues with benefits and debt, for example, alongside other things. So we are primarily a face-to-face service. The vast majority of our support pre-lockdown, as I'm sure many people in the meeting can probably empathise with, was kind of face-to-face support and a lot of practical work going on, all of which had to stop. So we had a number of kind of social groups which were running, which were kind of quickly identified that was a really useful thing for some of the people we supported. And we moved that onto a virtual platform, which was kind of flexible as to whether someone could access on the internet or they could just access it via the phone if they needed to. But in perhaps talking about that a bit later, the kind of learning point, Victoria, that you mentioned, the biggest learning point for us is the kind of digital literacy of the people we support, the kind of the low level of digital literacy of the people we support, and the kind of challenge that's posed for how we've been able to support people without seeing them kind of face to face. So whereas I'm sure everyone on this call can hop on a Zoom quite quickly and easily, we've not found, and we kind of knew quite early on that wouldn't be possible. And we've done quite well to adapt to that, but it's kind of given us some learning moving forward as to what more can we offer to not only kind of support people to learn about how to use digital kind of programs, but also how to motivate people who perhaps are kind of scared off by technology, perhaps. That's probably been our biggest learning point.
That's great, Josh. Thank you. Bob, I'm going to come back to you on your tech stuff, because when we spoke the other day, you'd kind of put some funding bids in and got round some of this issue, haven't you?
Yeah, so
it'd be useful to share that.
Sure. We actually got a grant uplift. I don't know if people are aware that with the National Lottery, there's an opportunity to go back to them and inquire about getting an uplift on your grant. So that's if you have one, obviously. What I did quite a bit of research, and even though I'm not an Apple user, what I did find out was that Apple was seen as the most friendly and easiest to use for complete new beginners. and they also have quite a lot of benefits in terms of really good warranty, customer services, and etc. So I actually went with Apple, even though it's quite a lot more expensive in general, their tech. And we got iPads in, and we also, as a business with Apple, we linked with a piece of software called Jamf, which is a remote device management system. So the idea is that we do all the setup on the iPads, because often that's quite a complex process for a lot of people to manage. We can remotely put apps on there. We can restrict apps. We can do all manner of things, actually, whilst still not interfering with any privacy in terms of themselves on there. But it also means that if the tech is stolen, we can close it down so no one else can use it. We can wipe data. So all of those kind of security issues that are a real headache if you're loaning out equipment, because obviously if you get a grant for something, it belongs to the charity and it's your responsibility to look after that. So yeah, that's how we manage that. I don't know if that makes sense.
Makes perfect sense. Thank you. Hi. Josh, what would you say that you found kind of the most challenging, apart from people's tech stuff and their sort of lack of it, from want of another description?
I think the sort of people we support are kind of, as I've mentioned, kind of particularly complex. So there's some people who kind of, for example, have a learning disability that we support, who may kind of find it a little bit harder than a lot of people to acquire, kind of retain information. So we essentially have turned all our social groups into a kind of fortnightly Zoom call, but understanding that some people don't have access to the internet. So some people are able to phone in, some people are able to kind of video call in, but even kind of a phone Zoom, if you like, with kind of verbal instructions that Zoom talks you through to get on there, has kind of taken quite a lot of kind of patience from individual staff to work through it with people who, you know, perhaps have only ever had to make or answer phone calls before. So I think the challenge has been kind of a two-part thing in terms of people actually having access to the tech that they need, and having a Wi-Fi connection as kind of, again, people we support tend to be on a lower income, don't have access to things like Wi-Fi that many of us would kind of take for granted when we kind of go on a Zoom call. I've had to access things in a different way. And the other part of the problem being we've just encountered something that people have never had to try before, have never needed to, but kind of through the kind of patience, and now doing the kind of, I think we're on our 6th or 7th group now, and people are really kind of getting used to it. And hopefully it's a kind of a push in the direction that whenever, as we know, none of us knows when the social distancing measures will be relaxed, and perhaps when the lockdown will be relaxed more generally. But hopefully this kind of experience of trying something new, digital wise, would help them to, if we were to kind of pursue a project in the future, to properly kind of educate people on the, you know, on perhaps the importance of kind of looking into having Wi-Fi if you can afford it, for example, and those sorts of things. Hopefully that would motivate them to be able to kind of do that. That's
great, thank you. Bob, are you still there? You are still there. There you go.
Sorry, I hadn't gone. I was just doing some typing. My camera was positioned really low.
Yeah,
on the keyboard.
don't worry at all. Well, I was just going to come back to you on the challenges after hearing.
Yeah.
That.
Actually, I just wanted to add, I forgot to mention with the iPads that there were cellular iPads, and we got a deal with EE as well around SIM. So obviously that's important, and make sure that the data is available.
Fab.
Anyway, yeah, going back to the challenges.
Sorry, Bob. Can you just tell us the name of the software again, please?
Yeah, so it was JAMF.
Type it.
JAMF. I was just about to type it down. But
Fab. Amazing. Thank you.
Okay. Yeah, so the biggest challenge. Well, I think on a kind of level where as an organization, you always try and bring people together. I think for me, the biggest challenge was getting my head around the idea of actually, here's a crisis, isolate. It was counterintuitive. We're all about bringing people together to share experience and to talk and break down barriers and bring communities together. And this new situation was the exact opposite. So that was really difficult, having to close the doors and say goodbye to people and not knowing what the future held. On a personal level, I struggled and still do with the leadership the country's having at the moment. I don't mean to be political, but I think that's a big worry for lots of people. And being in a situation where we all live in our own bubble and trying to comprehend the kind of complex situations people are living through and trying to deliver a service that supports them through those issues, that's really, really tricky, because normally we have all those stories brought to us and we're able to filter that information and find a good response to it. But now we're having to make those decisions a bit more independently and trying to understand issues.
It's really difficult. Josh, have you had people? How are we doing for time, Helen? Oh, looks like Helen's frozen for the time being. I was just going to ask you, Josh, how you found it dealing with people that are really unwell, and how you found that kind of not being able to be face to face with them, and what you've done that you have found has been helpful for them.
There's kind of no getting away from it, is there? It's a huge challenge to kind of transition from face-to-face support to phone support within the space of a week. And the kind of people we've supported have found it very difficult. I think what has helped is a kind of a committed approach and like really quite methodical approach from the team to make sure that everyone is contacted. And that kind of goes for the kind of people we're actively supporting, the people we may only see at groups. It's been a kind of a team-wide kind of cover everybody approach. And it's kind of much appreciated when some services perhaps aren't staying in touch as much as they could. There's an appreciation from the people we support that even though it's not quite at the same level as a face-to-face visit, they are still being thought of. They are still being supported in some manner. I think for the kind of staff team as well, it's been a challenge. So part of the kind of strength of improving lives, I think, and I haven't been here that long, but it's very, very clear that the kind of supportiveness of the team, not just kind of through regular supervision, but through if anyone has a difficult visit, that people rally around and people are there to talk to if you need them to. You take that entirely for granted not in an office. And the kind of nature of some of the phone calls we're having now are particularly difficult. People are really struggling. People are verbalizing that to their support workers. So our CEO, Kerry, very quickly identified that this would be a problem. We've kind of implemented twice daily Zoom calls, a kind of a slightly more formal one in the morning and then a check-in in the afternoon, which kind of maybe 2 months ago might have thought, oh my goodness, that's a lot of meetings. But it's so important to kind of give people a chance to get their whole day off their chest and to kind of bookend the day, if you like, and it's very kind of difficult to kind of keep to your hours as you otherwise would have. But the supportive element of what I think makes our service really great has kind of continued into lockdown and has been absolutely as good as it could have been. I also think it's this kind of, there's been other kind of strengths with the team as well. So we've used, with a kind of whole host of information coming out day by day. Certainly a month or so ago, there just used to be update after update about kind of what was changing in the lockdown and how we could access kind of support for shopping and prescriptions, which is quite a lot of the work, face-to-face work, the only sort of work we've been doing really in terms of face-to-face. So we used Microsoft Teams to kind of collate all that rather than having hundreds of email threads and impossible to find anything. We found the kind of Teams channel really useful for that.
Yeah, that really
and I can't remember what your original question was, Victoria, so I do apologise.
No, you've covered it. We've got a question up here from Debbie. So she was asking, what feedback have you had from beneficiaries? So I'd ask you both that.
Mm-hmm. Shall I start? It's been really, really positive, thankfully, and sometimes you get a little bit worried that you're just working with everyone that's coping, because we've had lots of really positive comments. The kind of the way that we've set it up, I think, has worked well in terms of it being very accessible. There are still some people that are struggling, and we are, like Improving Lives, doing those one-to-one chats and having lots of welcome calls for our new members, because we've got a new interim membership online to open it up to a wider geographical area, because now things have become more digital. We're not as restricted as we were before by boundaries, so in terms of geographical. So really positive, but you're always worried about the ones that you're not engaging with, so that's been my biggest concern. But on another positive note, and I know it's relevant with Mental Health Week, kindness has been something I've noticed. You know, it's always been there, but it's amazing how it comes to the surface from some of the most vulnerable, and people who have got the least to give often give the most, and I think that's something, you know, which is really heartening and positive to come out of this, I think. So,
no, that's fab, Bob. Thank you. I'm just looking at some of these questions that are coming up. So we've got one about legal support. Did you at any point require any legal support for your charities? If so, what support did you require, and how has it helped? So either of you.
do you want to go, Josh, or shall I?
I'm not sure we have received any legal support, actually. We haven't had to. You know, we do have a legal representative on the board who we have asked about kind of various things, and, you know, over the course of the time I've been here, but not specifically during lockdown. No, I don't know if you've got any experience with that, Bob.
No, I mean, HR has really been the headache in many respects, just ensuring that, because we've actually increased the contract of one of our workers, and we've only got one worker on furlough, but that was a unique situation because we had a cafe, and that cafe's obviously it was closed, and we were just about to change the business anyway to something else. So she was very happy to do training, which would help the future business anyway. So it worked out perfectly, because that's allowed legally on furlough. So yeah, no, we haven't had any specific legal issues, but HR is a kind of legal thing, and that's you know, been something that we've, you know, had to tread carefully, making sure we're doing everything correctly in that department.
Yeah. If you are funded by Lloyds, there is an offer for legal support, is there not, Helen?
Yes, I believe it's a part of our enhanced packages.
Yeah, we can find that out if that's helpful.
Yeah, I can do that in the background. We've also got Neil, one of our regional managers, on here. He might also be able to...
he will know, of course.
Sorry to default to you, Neil, but I reckon you've got the answer to that one.
Well, it's a good point. Oh, shall I quickly respond to that, or shall I do it in the chat box?
Go for it, Neil.
Okay, so in terms of what Bob said about HR support, yes, we do have some. So if it's about furloughing staff and the kind of what you need to do, the process around that, we can support that. We do also have Trust Law, which are an enhanced partner of ours, and they have loads of lawyers on their books who will give you pro bono support. So if you want more information about that, I can probably send some information in the chat box for you.
Fab, Neil, thank you. And we've got another question. What aspects of the new ways of working do you think you will keep going with, maybe permanently? So, Josh, you're on my screen.
Yeah.
I'm going to go to you first.
Yeah, no, of course. I think we were previously kind of looking at an office move, and we had like quite a fixed idea of what we wanted our office to be, based on what we currently have. And it's become abundantly clear that a number of us could work from home more often if we needed to, and maybe just on a basic level, we perhaps don't need as big an office as we thought we did. We have one service which provides a counselling support. And I know that our counsellor has said she's been offering counselling either on the phone or via Zoom. And she said that some of the people she's been counselling have actually preferred being supported over the phone or on Zoom. And there's kind of there's almost less pressure on them. They don't feel, they feel better about being supported over the phone. So although it's always asked in the kind of the forms to set up that service, what is their kind of communication preference? And it's almost always face-to-face is ticked, but it's turned out for some of those people, they might have thought that they would prefer face-to-face, but had they actually ever tried a Zoom call or a phone call, that is something that I think will change. It's also been mooted that a service of counselling could be provided further afield, purely over the phone or via Zoom, which we wouldn't have even perhaps countenanced before, because it has always been in our counselling kind of facilities, our office, which has opened up kind of new avenues for us, and potentially, more effective support that people didn't realise that they wanted, which I think has been unexpected and quite interesting for us. That's something we'll keep.
Cute. That's great, Josh, thank you. So we've got a few more minutes. Bob, can I come to you on that, things that you might keep permanently?
Yeah, I mean, the digital aspect, there's been loads of new skills learnt within the team, and strategically thinking ahead. Obviously I mentioned about the future being an uncertain one, the long-term implications for people's well-being, and the economic kind of outfall of this is something that if there's opportunity now, because there are lots of funds for the COVID thing currently, and understandably so. However, whether or not there's going to be funds to continue physical services, spaces, is a real concern in the future. And perhaps making sure that our platforms are in the right state for a future where maybe perhaps we have to do a lot more online, whether or not we like it, which, I think it has value. I've, to some extent, I've changed slightly. I used to think it had less value than it does. It does have value, but I think it's wise to invest in it now, because I think potentially we might not be able to do as much as we were doing before, the way we were. So that's my personal thoughts on it.
Great, thank you. We're getting some more questions, Helen. Do you want to deal with them in breakout rooms, or I don't know what might be more useful?
I think it might be nice if people can go to breakout rooms, because they might get some opportunities to ask these questions. If people do have things that aren't covered, we're obviously more than happy to pick those up separately. And I think Bob and Josh have said they're happy to kind of answer any extra questions afterwards as well. So yeah, should we move to breakouts?
Yeah, sure.
Yeah, thank you.
That's good.
Great. Well, thank you so much, Josh and Bob. That was hugely helpful and interesting. It's great to see that there are so many questions coming through, and what we kind of wanted to do was to give everyone else a chance to kind of share and reflect on their experiences as well. So what we're going to do is we're going to split you out into some breakout rooms. There are probably about 4 or 5 of you in each group, give you 10 minutes to have a bit of a conversation around kind of your reflections on kind of Bob or Josh's comments, or share some of your own experiences, or kind of ask some of your colleagues some of the questions that came through as well. So same as last time, you'll see a little pop-up on your screen. Click that, it will take you out and it will take you to a breakout. So we'll have about 10 minutes for that conversation. So I'll open those up for you now. Hi there everyone, welcome back. I hope that was a useful opportunity to kind of talk to some others and share some of your own experiences. What I wanted to do now is just get you all to have a bit of a reflection for a moment on what you've kind of heard during the session, taken away from those you've spoken to, and have a think about your one key takeaway or learning or thing you want to take back to your organisation. When you've got it, pop it in the chat and we'll get a nice flurry of takeaways from everybody in the group. So have a think, pop it in the chat, a moment just to reflect on what we've all had today.
I just wanted to ask if everybody felt they got their questions answered as well.
Yeah, Mary had one about concerns around one-to-one support and keeping records and other considerations. But if there's anyone else out there who had more questions, please feel free. We've got some great things coming through, lots of stuff about digital is key. Someone says something about JAMF software sounds great. Did they get the spelling right? I'm not sure. If anyone could help out Mary, that would be great.
Yeah, Bob, is that spelt right? JAMF, J-A-M-F.
I think you're on mute, Bob, but he's got thumbs up.
Yeah, I'm going with yes.
Yes, it is. Sorry.
Yeah, regular breaks and lunch breaks when working from home. If you've got Outlook, you can set it to do something called focus time. But I can't remember how you do it because it just popped up on mine, which is not helpful. Josh, do you know how to make it do it?
Sorry, Victoria, what was that?
Focus time. So it puts in lunch breaks and kind of to you time, it blocks it out.
I don't know how to do that. That'd be an interesting thing.
It's really helpful. I don't know about. I think in the foundation we're getting quite Zoom call heavy, so it's helpful to block it out. But anyway.
Yeah. I don't know if anyone looks at the kind of insights email that you get that looks at how much time you're spending in meetings and doing various bits. It's quite useful to learn how much you're working and to take a break. It tells you to take a break.
Yeah.
There's a really nice comment here.
I'm sorry.
That's through adversity has come extraordinary creativity. Too many examples to single out, which is a really great thing to hear in such a
it's fantastic. And I love that we are not as subject to geographical restrictions. It's true.
Yeah.
Very true. Yeah.
Somebody said here they'd like to be part of a group of managers. So the lonely leader stuff, but the name's gone. I didn't see who said that. But are you funded by Lloyds?
Yes, we are. Yeah.
So Neil, there's something we do for that, isn't there?
It's like question time, I imagine, isn't it? Earlier, when I came on here, it was like Star Trek. So for those of you of a certain age, like me, it's like suddenly Helen transports us down to the planet, and then suddenly we were transported back again, but just without the really nice fitted clothing. Anyway, but yeah, we do. And I actually just messaged Jamie to say that regionally, we've got peer learning forums. Now, those are a little bit patchy, but I think the point you made, Victoria, is really good and interesting, that actually maybe there's an opportunity to have something that's not geographically located and just for, you know, that's online. So
interesting you should say that, Neil, because we had that exact conversation about peer forums yesterday. A conversation of what might continue, what might conversation around what do peer forums look like in the future, and could a virtual non-geographical thing be a possibility? It's clear that people think that might be interesting as well.
So probably, Jamie, initially I would say go to your Lloyds Bank Foundation regional manager and find out, but also press the idea about could there be something virtual. I don't know which region you're in.
But we've been hearing that a lot, so we've fed that back as well, so I'm hoping that might happen. Do we get a copy of the chat, Helen?
I will do my very best to make that happen. I don't know, Zoom does strange things, doesn't always act the same, but I'll copy it into a Word and do my best to get it to you all. Yeah.
Thank you.
Thank you.
Brilliant. There's so many great things here.
So sorry, I've just seen, if you click the three dots at the bottom of the chat, you can save it. I don't know if everyone can see that, but yeah, there's like three dots bottom right of the chat column, and you can save it, which I had no idea. But
thank you.
There you go.
Oh, I didn't know.
Zoom in for 2 months and you learn something new, don't you?
Yeah,
Absolutely.
thank you.
Oh, I love that. The passion for your work is inspirational. I'm thinking that's for all of us on here.
Great. So I was just gonna ask Bob and Josh to come back if you had a final reflection, having spoken to others in the group as well, that we could kind of share with everybody.
Yeah, I think someone in my breakout room, I think it was Alison, was just saying how she had a project which was, I'm sorry, I'm doing a real injustice here, Alison, but it was kind of craft-based activities for a particular group. Sorry, Alison, it's a really rubbish description, but she was sending out postcards for people to kind of do artwork on, for people to send back and send to other people to look at. It was really inspirational to kind of hear about how, although the whole purpose of this webinar has been digital solutions, there are kind of, if you like, analog solutions like sending things by post, which has worked really well for some people, and kind of phone calls for us, is you might still consider that analog, have been like the biggest lifeline for people. So I suppose my takeaway is that it's incredible to hear what everyone's doing digitally speaking, but there are kind of, I guess, I hate the word, but holistic solutions out there which digital isn't going to suit everybody just at the moment. And it's really inspiring to hear what kind of people are doing non-digitally too.
Okay, just for my little bit as well, as we were talking, it kind of occurred to me that even though we've opened up the membership broadly, what I've noticed online is the ones that have really engaged well with it were the ones that we had that relationship in real life with. And I think digital is okay, but I think if you haven't got that relationship to start with, it's really hard. It's quite an odd environment to develop new friendships, I think, and I don't know whether that will change as people get more familiar with it. So that's something I think we have to make sure that we don't use this as, well, we don't need that, so let's just do this now. Yeah.
Thanks. Victoria, do you have a final reflection at all? You joined the breakout group as well, so it'd be interesting.
Yeah, we were just talking about the idea that some of the things that we've had to do should become permanent, but also that we need to find a solution to the issues that people have got if they haven't got the tech and they haven't got the money to access it, because I cannot speak, sorry, digital divide is just going to get bigger otherwise. That was all, but no, it's been fantastic. Thank you. I've learnt a lot.
Great. Well, thanks so much for everybody. We'll share the recording and the chat with you all afterwards. I hope that you found this a really valuable hour. I appreciate you all really busy people in this really difficult time, so thank you for joining us. This is fairly new to us as well. We've had to learn about the online world and putting events digital and the rest of it. So just before you leave, it would be really helpful if you could just answer 3 questions for us, just to kind of help us when we're looking at doing more of these sessions. But it's been really, really great to meet you all. Thank you for participating. And if you've got any more questions for us, don't be afraid to get in touch, and we'll do what we can do our best to do what we can to help out. So thanks very much, everyone, and thanks to Josh, Bob, and Victoria as well.
Thank you.
Great.
So you should see a poll just come on your screen. If you'd be happy to fill that in before you go, that would be hugely helpful.
Just before you all go, I'm sure you've all done a few of these now, with lots of kind of charities being on a Zoom call, and it's genuinely just a pleasure and a delight just to hear about other charities and all the amazing work you're doing, because sometimes it can feel that you're working in a silo and you're just kind of doing your work and supporting the people you support. But yeah, it's just, thank you so much, because it's just always lovely to hear and how passionate everyone is about what they do. So thanks.
Thank you, Josh.
Thanks, Josh.
Thanks, everyone. Thank you.